Picture this. It's a Tuesday morning around 11 a.m. It's my first day interning at the Center for Recovery. I'm observing a rehab session, and the topic is relationships. I sit in the far back corner of the room, and all I can hear is the rapid pulse of my heartbeat in my ears. I rub my sweaty palms against my pants, and I stare at the floor as patients begin to shuffle into the room. I have absolutely no idea what to expect. The rehab counselor poses this question to the 15 patients sitting in front of him. Tell us when your life became unmanageable due to addiction. Jane, the first to speak, is known to be one of the younger and more energetic members of the group, yet today she looks tired and dejected. As Jane responds slowly, I hear 11 words that change my perspective forever. I hit rock bottom when I put heroin before my son. She looks down and continues by saying, as it took over my life, I stopped spending time with him and caring how he was doing and started caring more about the drug. I was in shock. Out of all of the research I had conducted, physicians I had interviewed, and medical journals I had studied, these words are what impacted me the most. Not many people are aware of how dire the opioid crisis is within our own county. Growing up, I always used to see on the news stories of homicides, drug raids, and shootings throughout the nation. Last summer, I began to look into this nationwide epidemic. What I found was truly eye-opening. According to the CDC, every single day on average, more than 115 Americans die from overdosing on opioids. Millions of Americans are being affected by this crisis every single day, and I wasn't even made aware of it until last year. Yet the crisis truly hit home when I began to hear that these stories were happening in my own hometown. Since April of 2017, there have been 213 recorded overdoses in Orange County. And from 2015 to 2016, the overdose rate jumped 194%. Many of those affected go to my own high school, Newburgh Free Academy. Signs of drug abuse are visible in some parts of town. On the streets, parking garages, and vacant lots, needles and vials are there to be seen, and for most citizens, avoided. My interest in the opioid epidemic motivated me to create my own research project, focused on analyzing the availability of Suboxone, a treatment drug for opioid dependency, within my county of Orange County, New York. Suboxone minimizes withdrawal symptoms, helps curb cravings, and removes the euphoric effect of opioids. While it is one of the leading opioid treatment drugs in the nation, it plays a surprisingly small role in my county. I began to interview local physicians to learn more about Suboxone and to understand their overall opinions on the crisis in my county. From my research, I found that there's a social stigma surrounding this treatment drug, whether it was for patients who were taking the drug or for physicians who were prescribing it. The stigmas surrounding treatment centers and addicts have caused many to turn their heads away from the crisis instead of stepping up and taking action. Many patients, however, want to turn their lives around and are in dire need of treatment. I couldn't understand why something that could bring hope to so many people was so frustratingly underutilized in my county. So I reached out to a doctor at the local Center for Recovery to continue my research. Tucked away from view, the Center for Recovery is a battleground where drug-dependent patients fight to survive and regain control of their lives. Most people in Orange County don't even know it exists. Here, I was able to meet and observe patients in treatment, finding what it truly means to struggle with drug addiction. Let me tell you another story. Per usual, I'm at the Center for Recovery in the back corner of the room observing. As I look around, most of the patients have their heads down or just aren't paying attention to the lecture at hand. One man to my left catches my eye. Ralph has the sign-in sheet in his hand, but he's consistently dozing off. He suddenly jolts up, confused. As he turns to look at me, I can't believe what I see. Ralph's eyes are droopy and bloodshot, and he has bright red sores on his face. When he spoke, his speech was slurred. Recalling his eagerness to start treatment just a few weeks back when I first met him, I would have never expected him to relapse so quickly. He had seemed truly determined and motivated. These stories put a face to my research and have allowed me to gain a greater understanding of the crisis in my county. I have realized that in treatment, every minute of every hour of every day these patients get through without relapsing is a minuscule step toward recovery. Witnessing the grim struggles of those seeking rehabilitation, I now see these patients beyond the stigma surrounding them, their physical appearances, and their backgrounds. Rather, I see their willpower and determination to achieve recovery. No one seems to trust or believe these patients because they may lie or cheat to get what they may need. Patients struck by the harsh force of reality become torn between returning to the interminable cycle of addiction or facing the overwhelming struggles that they've pushed away for months, years, or even decades. Without pharmacology, they cannot even begin to recover. The cycle of addiction repeats itself over and over and over and over again. The knowledge I've gained from this experience is something that has affected my views of those suffering, and is something that has not only changed my entire perspective on the crisis in my county, but is something that has also changed how I view the research process. Seeing members of my own community succumb to this disease makes the problem real and potent, but hearing the narratives of those affected made me develop empathy for them. The compassion I now feel for these patients could not have been gained from online research or surveying doctors. Meeting these patients has not only taught me so much about their lives and who they are, but about who I am. I've realized how privileged I am and am so grateful for the life I have. Addiction tears apart lives and families, and I feel a need and a calling to help fight it. Now that I've told my story, I urge you to step up and take action. I've heard patients recount how their lives were consumed by their drug habits or discuss the dull cravings they now feel while in withdrawal. Listen to the stories of those in need and hear their cry for help. Help me, alongside millions of others, rise up against addiction and take action. Help me impact policy change by participating in local forums, reaching out to your local senators and politicians, and working with community leaders to help prevent this public health emergency from spreading. Help me break the chains of addiction so that you will never have to fear that your brother, your best friend, or your mother may ever succumb to this disease. There are currently 150 people on the Center for Recovery waiting list. I know that I can't listen to each person's individual story, especially because the numbers that want to turn their lives around are growing every single day. Yet by staying involved and listening, I know I can make an early contribution to the growing national response to this titanic health threat. Every life is worthwhile. Every life is worth saving. How will you find a space to listen to those who need our help? Thank you.